Hi, Bio20, our final segment of Chapter 7, Respiratory Disorders today. And I'm thinking you can complete your notes and then have a listen to the video lesson about the most important parts of 7.3. So we start off with looking at the infection kind of terminology. Whenever it says itis, it's an infection of something. And tonsillitis, of course, is an inflammation infection of the tonsils, which, if it continues, sometimes are removed, although not as often as they used to, because they feel that there is a job that the tonsils actually do, which is helping to reduce bacteria from going further into your body. Here's what looks to be swollen tonsils, maybe strep throat. You can see the infection in the white areas. Another itis here, laryngitis, inflammation of the larynx. So sometimes people actually entirely lose their voice when their vocal cords are inflamed and infected. Very sore throat with laryngitis. And so you see infection in the vocal cord area in this picture. Another itis, bronchitis, of course, inflammation of the bronchi. And when that happens, it will be hard to breathe. Sometimes there's extra mucus, extra coughing, and sometimes this can lead to some very much difficulty breathing. So you have trouble getting air down to the lungs. Pneumonia is when the alveoli fill with liquid because of some infection by either viruses or bacteria, as shown in this picture. Pleurisy, inflammation, another inflammation, this one of the pleural membrane surrounding the lungs, which means that there will be that kind of friction between the pleura if they're inflamed, and it causes a lot of pain with every breath. Emphysema is an important one. This is when the alveoli break down, and often related to smoking. But what happens is that as you get less functioning alveoli, you have less area for proper gas exchange, and so breathing is very difficult. So someone might be able to take a gasp of air, but then they have a hard time releasing that air, and they kind of whistle as they exhale. COPD is a video you can take a look at. Okay, so we're looking at how emphysema looks on a X-ray. You can see that the alveoli are collapsed on this side of this image. Cystic fibrosis is a genetic condition that causes extra mucus to be formed in the lungs. This is a great video, take a look at it. And one of the treatments is that someone's back needs to be pounded to release that mucus, and they are doing research on genetic cures to this by getting the correct gene sequence into cells of the lungs so that some of the cells stop making mucus. Lots of research going on with cystic fibrosis. Asthma is a very common condition where there is inflamed airways that can be caused by a lot of things. Environmental contaminants, could be pollution, could be pollen, it could be dust, it could be all sorts of things, even exercise-induced asthma, a lot of things that can cause your body to inflame the respiratory tract. And this is where some people recognize these triggers and carry a puffer so that they can open up their airways should they have an episode of asthma, an asthma attack. And when the airway closes, when the bronchi trachea and bronchi, bronchioles close and get swollen and get extra mucus, you can see how it's much harder to move air through the airway. Lung cancer, every kind of cancer is an abnormal growth of cells that are non-functioning cells. So they take up oxygen and nutrients and space of healthy cells, but they don't function. And so as they take over, those are cells that definitely become a problem because they take up space that now is not being used by functioning cells. This picture is in your notes. You guys can fill out the disorders here that match the explanation and check it with this page. This picture looking at blackened lungs because of the tar that's collected from cigarette smoking, and that has so many carcinogens or cancer-causing substances in there that it forms these tumors or carcinomas all over the lungs. And there you go. This was showing you how the cancer or carcinoma can invade and end up having little pieces of it connect into a blood vessel, and then the blood can carry it to other places in the body, and then the cancer does have a possibility of spreading to other places. And I think that's it for that picture. And it says 90% of lung cancers does happen in smoking individuals, and chewing tobacco can cause cancers in the mouth. And if they are cancer-causing agents, they're called carcinogens. A lot of those in tobacco: formaldehyde, lead, radon, asbestos. These are all found in cigarettes and other inhalants. And cancer assassin and how it affects your immune system. Check that out. TB, tuberculosis, is also something that affects the lungs. Little bacteria go in there and form little tubercles around themselves. And basically, tubercles are a bunch of scar tissue, and those bacteria are locked inside of those tubercles. When their immune system goes down, you can check out the video, then they can come out of those tubercles and start spreading into other areas as an active bacterial infection. And it gives you these symptoms if you do have tuberculosis that's active: weight loss, fever, sweats, loss of appetite. And it's something where antibacterial drugs can be effective in curing TB should you be diagnosed. Some stats here, and I think that wraps up that. Intubation, this was a video I included because we were using this intubation tube when Mr. Hoffus brought in a lung from the meat packers, and intubation tube was put into the trachea, and using a bicycle pump, we did a demonstration to inflate the lungs using this intubation tube, because this bubble here was inflated and could seal off the trachea. So then all the air going into the tube was going into the lungs and showing how the lungs become inflated. And I think I can likely find a video for you to see about how that looked. These notes are in your textbook, Treating Lung Disorders. Check those out. A few more effects of smoking. You guys can take a good look at those and see how that compares to components and effects of things like vapes, which basically will destroy alveoli. Cigarettes deposit all kinds of tar and carcinogens in there. And hookah, also a lot of chemicals. Hookah, though, because of the moist and warm environment, is also harboring a lot of bacteria, viruses inside the hookah itself. And so not only do a lot of shishas have nicotine in them, so they are, in most cases, well, 100% of the time that, according to the health unit presentation, they have addictive nicotine components to the shishas, the hookah, because of that environment that's warm and moist. A lot of people can get other lung viruses, bacteria, tuberculosis from using hookahs in public places, because those just stay and grow inside those components of the hookah. A lot of other effects here you can read for yourself of something worth taking a look at, effects of hookah. Super smoking little clips here, videos. Take a look at them. I included a lot, and you guys will learn a lot by taking a look at those. This is a wrap for Chapter 7, and thanks for watching this video lesson. Lots of little bits that you can spend some time on, especially all the video links, as you look at the PowerPoint on your own time. Otherwise, make yourself some notes on these, and I will talk to you soon, and bye.